to be active on the Milan Urban Food Policy Pact. First of all, I need to tell you what we are. To present ourselves, I obviously said that we are an organization that is promoted by WHO, and we are a movement of cities all around the world. In Europe, we are 1,400 cities in 30 countries, and of course, we are present here in Tel Aviv, and I thank you, the person that organizes all the activities here in Tel Aviv. In Italy, our project started in 1995, and now we are a legally recognized association. I want to show you the cities that are in all Italy, and there is a steering committee that organizes all our activities. I'm coming from Modena, that is in the northern Italy, and we have the opportunity to have the presidency and the coordination of the activities. But as you can see, many municipalities are in the steering committee, and some cities like Milano, Torino, Venezia are here to work together. I have very little time, so I want only to say the title of our activities. What are the lines of work? The projects that we do are on sustainable mobility, healthy and right eating, physical activity, promoting physical activity not only in young children but also in adults and elderly people, healthy lifestyles. And it's very interesting for us, the relationship between environment and health, or urban planning and health. And of course, healthy aging, because as you know, Italians are very old population. What do we do as a Healthy City Network for the Milan Pact? We started in October 2015 with this meeting that was really important, an important start for us. So we wanted to find out how could we pass from good practices to good policies. The five themes were urban agriculture, local food, sustainable diet, food and poverty, and food waste. And in the same day, 16 mayors signed 16 mayors that are belonging to our network signed the Urban Food Policy Pact. So we are, I think, also a way to widespread the ideas of the pact. Of course, one thing that I find particularly important is that these projects must go on. They must continue, develop, and if it's possible, become better. So after 1 year, Torino municipality, Palermo, Ancona, Modena, Bologna, and Udine were coordinator cities. They collected the best practice from the cities, and we discussed together after 1 year what we had done and what we could do to realize better practices. I think it was important for us to state in a document that was sent to ministers, to FAO, to ENSI president, how we want to stress the engagement of our local authorities. We wanted to sign that the implementation of the Milan Food Pact can only pass through local policies. I mean, it's important that a government is involved, but only local policies can do more. Second point, food education must be done through a strong alliance and a sharing between school, healthcare, community, local producer, and distribution. Is what we call, when we do a project, a community project. And then there are other important points about waste reduction practices, about how food is also a way to redesign the cities and recover urbanized soils. And of course, as you said, the importance of collective catering that can't become a service on demand, but is a way to promote public health. So I think the time is quite going on. And I wanted also, I will give you the slides about how we are trying to evaluate how these projects influence the health of children. Okay.
Thank you. I just want everyone to know all the slides will be available on a webpage, the full set of slides, because they're wonderful slides. And our next presenter is from Modena, which is one of the best food cities in Italy, I think, and that's Alexandra Filippi.
Thank you. Good morning. I'm Alessandra Filippi. I'm Deputy Mayor for Environmental Policies, and I'm speaking about a project Informa a Scuola that deals with healthy lifestyles promotion to prevent overweight among children in primary school. I'm sorry, my English is very awful, very, very awful, and I'm reading with you the slides, and it's so better. The municipality of Modena, Northern Italy, in collaboration with the local health authority, has been organizing numerous health education interventions in the primary schools to prevent childhood obesity as part of the project Informa a Scuola. The project focuses on healthy dietary habits and physical activities in the context of the WHO European Programme Healthy Cities, of which Modena is the Italian coordinator. In 218, in collaboration with the University of Modena and Reggio Emilia, a survey has been designed to evaluate diet and physical activity of children and parental perception of childhood overweight. Study design, excuse me, one more, yeah, okay, yes, okay. A cross-sectorial study was conducted in February of this year, involving on a voluntary basis children and their families attending the first class of 29 public primary schools in Modena. A self-administered anonymous questionnaire was proposed to the parents with an introductory letter after obtaining a written consent. The questionnaire included information on socio-demographic characteristics of children and parents. This is the data collection, the children data, anthropometric measures used to calculate the body mass index for classification of children in categories following the USA Center of Disease Control suggestions: underweight, healthy weight, overweight, and obese. Physical activities, information on hours watching TV daily, days for sport activities, and mode of transportation to go to school. Dietary behaviors, daily consumption of fruits, vegetables, sugary or carbonated beverages, and the habit to have breakfast and a mid-morning snack. Okay. This is the parents' data. Parental perception on their child's weight category. Do you think your child is underweight, normal weight, slightly overweight, very overweight? And on usefulness of healthy dietary education and physical activities at school, 5-point Likert scale from 1 not useful to 5 very useful. This is the results. Okay. 661 questionnaires, almost 75% of the total children population. Children overweight obesity, 25%. Fruit, vegetables consumption almost 61 less than 3 portions a day. Skipping breakfast 11 and 5%, and skipping mid-morning snack are significantly associated with parents' low education and also with foreign nationality. Physical activity, 58% make less than 5 days a week, in particular among immigrants. And 41 and 6% use car and bus to reach school, in particular among Italian families. Habits significantly affecting children's overweight are skipping breakfast and mid-morning snack. Parental perception, sorry. 16% of parents did not consider healthy dietary education activity at school as useful. This lack of interest is connected to mothers' low level of education and to mothers' foreign origins. 25% of parents were not interested in physical activities at school during non-school hours. Among families of overweight or obese children, 60% of parents incorrectly perceive their child's weight status. And now the conclusion. Our survey confirms the high prevalence of overweight among 6-year children, mainly associated with unhealthy dietary habits. Moreover, the consistent underestimation of child weight suggests that parents' misperception represents a critical pathway for intervention.